or two people heading in, but I think they've made their way in here. I saw one of the last gentlemen that had come through on the parking lot. We were trying to give people a few more minutes to connect with us. But good morning. We certainly appreciate you coming out this morning. My name is Trish LaBeouf. I am the Director of Insurance and Benefits. I am really hoping that today's morning session provides some good information for you. We really just want you to walk away with a little bit more information, education on your Medicare services and what's available to you. We have the Louisiana Department of Insurance this morning that's going to just talk on those benefits. And then what we're going to do, I believe if everyone should have received the LPSS folder when you walked in. That information in there basically has our agenda listed. We're just going to talk through your Medicare services first with the Department of Insurance. Then we're going to have a short break. And then we'll come back, and a lot of the communications that have been going out from our department, I figured there may be questions on those communications. So I was going to put up the information, and we'll just have a general Q&A, and we'll talk through any questions that you may have to help point you in the right direction based on, there's been a lot of communications this year just because there's a lot of new changes. So that's your simple agenda. I do appreciate your time. Thank you so much for coming out this morning and at least listening to what we have to offer. I appreciate everything, and I'm going to turn it over to Ms. Vicki, who is from the Department of Insurance.
Good morning. Thank you. Good morning. Come on, now it's Tuesday. I understand we all have fog brain today because it has been, foggy the last couple of days. And based on the Weather Channel I was watching at home, which I'm from the other side of the basin. I'm from the other side of Baton Rouge. I'm from close to Hammond. So, it was quite an experience driving in this morning. However, there was more fog coming into Baton Rouge than there actually was coming across the basin, which was a nice change of pace. So as Ms. Trish introduced me, my name is Vicki Dufresne. I am with the Louisiana Department of Insurance, and I am here to make sure that we are all on the same page as we go forward under Medicare. So if I can see a show of hands, please, of individuals that are younger than 65. Just a couple? Okay. So I just want to make sure, because they're going to have questions, and some of you may have been on Medicare for a little bit, but you're not quite sure how it all works together. You just knew you had to take it, but I don't know why and what it does and this kind of thing. So I'm hoping that when you leave here, you will have that understanding. So did everybody grab one of those bags, that was out on the table? In that bag is a booklet that looks like this. If you take this booklet and you open it from the back, there is a notes section in the back so that you can take notes as we talk. Questions that you may think about that you want to ask. There's some pens out there if you need an ink pen. But just so that we all are good with what we're going to talk about. Now, if you open it from the front, most everything I talk about is in this little packet here, this little booklet, but also in the materials, and I'll reference them as we go through them. So to get started, I want to get started with Medicare. I want you to understand what we are talking about. And I also want to be the first person to tell you that what I'm going to be talking about, I do have some rules and regulations that I have to follow. Medicare is a federal program. However, I work for the state. And so there are federal rules and state rules that govern Medicare. So just so we're clear, a lot of what you're going to hear is because I am known as the queen, and I am a benevolent dictator. So what I say goes. I'm just picking. But yeah, there are some rules and regulations that we'll talk about, and that they are law, and I can't change them. Okay, so first thing is that Medicare is typically for the golden age of 65. It is federal health insurance. It's what you or your spouse has been working and paying into the Social Security system for. If you looked on your check stubs, you always would see a Medicare tax or a FICA tax. That's what you were paying. You were paying into the system so that when you got to the golden age of 65, or in some cases may have become disabled, you may have had a heart attack, a stroke, you may have contracted some disabling condition and could no longer work, and you applied for disability benefits. But ultimately, we get to this point where we become eligible for Medicare. Some of us may get it because of disability or Lou Gehrig's disease, ALS. But those are some disabling conditions that would prompt an individual to become Medicare eligible prior to age 65. But 65 is the golden age for Medicare. 62 is the golden age for Social Security. That's the earliest that someone could draw retirement benefits through Social Security. For those of us that are a little bit younger, I'm 57, so full retirement age for me to be able to draw my full Social Security check is going to be 67 and a few months. So there's a lot of different age brackets or age dates that can become confusing. 62 is the earliest you can draw retirement Social Security. 65 is the golden age for Medicare, and for those of us that were born in 1960 or later, the full retirement age is 67. So you've got a lot of different age brackets going there. Now, when you apply for Medicare, you are applying for Part A, which is the hospital, Part B, which is the doctor. That's what's going to come on your card. And then as of 2006, we added Part D, which is the prescription benefit. Now, that will not come on that red, white, and blue card. That is going to be an insurance product that you are buying from a company, and we'll talk a little bit more about that as we get into the presentation. But these are what we consider to be the basic parts of Medicare. Now, if you are fortunate enough to draw Social Security prior to 65, and we are going to focus on a minute that you are not working. You've put in all of your years and you retired, and let's say you retired before age 65. And you started drawing a Social Security check, or your spouse was drawing a check, then your card or your spouse's card is going to come automatic in the mail to you based off of you getting a Social Security check. It will typically come 3 months before your 65th birthday, the month of, or 3 months following is the time that you can apply. But the card and this little welcome packet generally come in about 2 to 3 months prior to your 65th birthday. Or if you are getting disability 2 years after you have been deemed disabled by Social Security, the card will come in the mail that 25th month, and you, as a Medicare beneficiary, will have the same rights and responsibilities as someone that is 65 and older. Now, if you are not drawing Social Security, maybe you were holding off till full retirement age, or it could be that you went to Social Security and they said you worked for the school system the whole time and you're not eligible to get your Social Security check, but you need to apply for Medicare anyway. That being said, you would do it through the Social Security Administration. They are the gatekeepers. They are the ones that take the application for the check and the Medicare card and your Social Security card if you lose or misplace it. So this would be the website where you would go at ssa.gov, which is the Social Security Administration.gov. And you can apply for Medicare through this or go to your local office. This is the card that's going to come to you in the mail. Oops. It is your red, white, and blue card. It is going to have your name and a Medicare Beneficiary Identifier, or MBI. That used to be your Social Security number or your spouse's Social Security number. Some of you may still have your old card. These changed just a couple years ago, and we went away from using the Social Security because of so many people being scammed or their identity being stolen. So we started using this algorithm that combines numbers and letters and makes no sense to anybody. So it will show when you applied and when your Part A becomes effective, which is the hospital piece, and when your Part B is effective, which is going to be the medical or the doctor side of it. Once this card comes in the mail, you can go to Medicare.gov and create an account. You can see a copy of your card. You can download a copy. If you misplace it, you can go there and request a new card, as well as seeing all other information that you are eligible for as far as the Medicare side goes, like preventive services and such. So to apply for that card, you're typically going to do Medicare 3 months before your 65th birthday, the month of, or 3 months following your 65th birthday. That's your initial enrollment period. If for some reason you miss your initial enrollment period because 65 is a golden birthday, most of us have decided we're not working past that date. So we are going to live life. We've got a whole new chapter that we're about to experience in our life. And if we do not enroll in Medicare during that time period, the next option that we have will be, oops, I moved the wrong one. The general enrollment period, which is January, February, and March, and your Medicare will start the month after you make application. Now, this is based on you not working, okay? You are retired and need to do this. How many of you thought you might have to work past age 65? That's going to be my husband. I'm not letting him retire anytime soon. He's 64, and I've told him he's got to work till he's at least 78. The closer to the ground, the better that paycheck is. No, I'm just picking. He's got just a few more years. But he will potentially work past his 65th birthday. So that being said, then when he decides to retire, he will have what is known as a special enrollment. So women, how many of you still have your spouse, your man out there working? For those of us that do, this will be the time when they will apply for Medicare. Men, we're not working past 65. We've already made that distinction to you. So if you work past 65, when you decide to stop or when we allow you to stop, then you will get an 8-month window at which you can apply for Medicare, and it will start the month after you make the application. So if I allow my husband Randy to stop working in December, then we make an application in January. His Medicare would start in February. If we do it in December, Medicare will start in January. Simple way that it goes. And as long as he has had insurance through either his employer that he was working for, or he's covered as a dependent on my insurance because I'm actively working, there will be no penalties assessed to him. Now, if he's not covered by insurance but just continues to work past 65, then he runs the risk of potentially having what we call a late enrollment penalty. And how many of us have forgotten to pay a bill? And we get done. I forgot to pay our internet bill the other day, and he calls me and he says, the internet's not working. Oops, I'm sorry, I forgot to pay this the other day. So I got a $10 charge put on it that I had to pay, an extra $10. Okay, big deal. Well, for Medicare, that is a big deal. It is a lifetime penalty that you would have to pay. And it is 10% for every 12 months that you went without Part B as in boy coverage when you should have taken it. And it is based on whatever the Medicare Part B as in boy premium is at the time of application. So for some people, if you wait several years, that penalty can be rather expensive. Now, we talked about that. So let's get to exactly what is Medicare. So Part A is the hospital piece of it. That's what works when you go into the hospital. Now, in your packet, you have a piece of paper that looks like this, that says ship on the front of it. This is going to have some dollar amounts on it that are going to be equivalent to what's on the screen up here. So if you go in the hospital and you stay 1 day or 60 days, you as the policyholder or the Medicare beneficiary are responsible for $1,632 of your hospital stay. Now, that's figures for 2024. We do not know what 2025 will be, what their new Part A and B out-of-pocket cost will be, but every year this seems to increase. So just know right now you have just Medicare and you are admitted to Lourdes. You are going to be responsible for $1,632 of that hospital bill. Now, if you stay 1 day or 60 days, that's your responsibility. When you are discharged from the hospital, and you go to a skilled facility, I need rehab because I had a stroke. I need to learn how to use my hand, my leg. I need to learn all of these new therapy, these occupations all over again. When I am discharged from the hospital and go to the rehab facility, Medicare says I am entitled to up to 100 days of skilled care. The first 20 days, Medicare is going to cover at 100%. Beginning day 21, I am responsible for $408 a day. No, excuse me, $204. I do this every time. $204 a day from day 21 to day 100. Now, in that same scenario, I am discharged from the hospital, but I don't need to go to rehab. I'm good. I just had a little mild heart attack. I stayed a few days. They did a heart cath on me. I got a couple stents. I'm ready to rock and roll. I go home, and I'm home for about 2 or 3 months, and I think I can climb the top of my husband's shop and put a box up there because there's no stairs. It's just a ladder, and the ladder's not quite secure enough, and I fall, and I break a hip, and now I'm back in the hospital. I have been out of the hospital for longer than 60 days, so I'm going in. I'm going back to Lourdes. I have a new benefit period. Vicki has to pay that $1,632 again. So, what am I trying to tell you is that under original Medicare, there are benefit periods when you go in the hospital, and they are 60-day increments. And if you go in and come out and do not break that 60-day cycle, your days continue to add, and you may only pay an inpatient deductible one time. However, if you go in and come out and stay longer than 60 days, stay out longer than 60 days, you could have multiple benefit periods in a year. So it is different than traditional insurance that says you have a calendar year deductible of X dollars. Hospital under Medicare is based on benefit periods. If you stay in the hospital longer than 60 days, Medicare will start charging you per day at a rate of $408 per day. So I went in the hospital and I had the heart cath done. So let's back up. I went in the hospital because I had a stroke, remember? And then I came out. I went to the skilled facility. I ended up having a heart attack and had to go back into the hospital. And I stayed 5 days, and then I came out. Excuse me. Then I climbed up the ladder, and I fell and broke my hip. And all of this time, I was never out of a facility for longer than 60 days. Never out of the hospital, never out of rehab. I kept going back and forth. I get to 61 days of going back and forth into the hospital, Now Medicare's charging me $408 per day. Now Vicky's decided she is going to be a lot more healthier with what I eat, with exercising, and I'm not going to climb ladders anymore unless they are bolted to the wall and I won't fall off. Any questions on the hospital side? Now, the medical side. How many of us go to the doctor? All of us. First, at some point in our life, pretty much everybody has been to the doctor. Under Original Medicare, you have a calendar year deductible, and this wonderful year, it is $240. That means you have to pay the first $240. Then Medicare picks up and pays 80% of approved charges, and you are responsible for 20%. How many of you know what 20% is? Nobody. Because you don't know what the charge is, so you can't do the calculation to determine what 20% is. I know 20% of 100 is $20, but that doesn't mean that every time I go to the doctor, that's all I have to pay. If I have just Original Medicare, it's 20% of the approved charge. And under B, that's going to be where you get your flu shots, your pneumonia shots. How many of you men, your wives make you wear a CPAP machine? You know, one of those breathing machines at night, or the wife says you need to be wearing one, but you don't listen. Well, my husband's one of those. Diabetes. We love to eat. So some of us may have diabetes, and we have to test our blood, our lancets and test strips. That comes under Medicare Part B, as in boy. Home health, if you need it. Any types of occupational or speech therapy will come under Part B, as in boy, as well. So this is the part that you will utilize the most. My mom is somewhat healthy for the most part, but we've noticed that she has lost some muscle strength and doesn't walk. Her gait's not as good as it should be. So we've asked her doctor to prescribe her some physical therapy to help her build up her system again. That comes under her Medicare Part B, as in boy. So things like that are what are going to you will use your Medicare Part B for. Now, Part B comes with a premium. It is typically withheld from your Social Security check. However, if you're not eligible for one, or if you're waiting to draw it, then you're going to get a bill in the mail. And that bill comes every quarter. And it's going to have at least 3 months' worth of premium in it. The standard premium is $174.70 a month. However, some individuals were fortunate enough to make a higher income. Those individuals that have that higher income have to pay a higher Part B, as in boy, premium. And if you flip this flyer over, it's got those dollar amounts on the back side of it. So in saying that, some will pay it, but every year Social Security looks at what your adjusted gross income is. And if you are paying a higher Part B, as in boy, premium in the beginning, it can drop over time. This is based on, as I said, your adjusted gross income that's filed with your income tax. Excuse me. So if something has happened and your income changes, always get with Social Security to make sure that they make the adjustments accordingly. Now, we talked about Part B comes with a calendar year deductible, $240. Then Medicare covers 20%, Medicare covers 80%, and you are responsible for 20%. What's not covered under Medicare? Well, I really want to have Botox, but that's not covered under Medicare. I think these wrinkles need to go away, but they'll be here for life. Also, things not covered are my eyeglasses, because that's considered maintenance. Although, how many of you have had cataract surgery? That's covered, but eyeglasses are not. I love a good massage. I'm not going to lie. But that's not covered under Medicare. So these are a few things that are not covered under original Medicare A and B, but may be offered under your insurance product. Now, should you sign up for Medicare? How many of you in here are not working? You're retired. Everybody. So everyone should have Medicare A and B. If you are working, are covered as a dependent by someone that is working, you don't necessarily need to sign up for Medicare Part B, as in boy, while you're working. You can take A. It's free for most of us, but it's only going to work if we go in the hospital. But B will work when we are going to the doctor. So some may take it, some may not. But when that policyholder that is no longer working retires, it is mandatory that you take it if you're of age. Now, so we looked at this sheet right here that shows all of those out-of-pocket costs that can put a person at risk for using all of your savings if you don't have something in place to help if you have medical expense. So let's talk about how we fill in the gaps to make sure that we don't use all of our drop money, all of our savings. And there are two ways to do that. Original Medicare, or you choose a Medicare Advantage plan. Now, the Advantage plans are what you are seeing advertised on TV right now. And we're going to talk about those in just a second. But under Original Medicare, you have an option to get a Medicare supplement, which is an insurance product sold by a company, and you are paying a monthly premium for it, and it fills in the gaps in parts A and B, and it looks like this. It comes by letters of the alphabet. You have this chart in your handouts. You have a handout that says, one side says 2025 Medicare Part D standalone prescription drug plans, and the other side says Medigap plans coverage in 2024. So we're going to focus our attention to the column marked G as in girl, because that's the plans that are being sold at the moment. You can pretty much buy any of the plans on here except for F, as in Frank, unless you were Medicare eligible prior to 2020. But G is the plan that most people are purchasing now. So I'm going to go down that column with you so you can kind of understand what it's talking about. So let's focus on the line that says Part A deductible. Come over to column G and it shows 100%. Remember, Vicki went in the hospital and was responsible for $1,632, and she may have had to pay that several times because she went in and out of the hospital. If I have a Plan G, it's going to pay that $1,632 at 100%, no matter how many times in a year or in my life that I go in and out of the hospital. Once I am discharged from the hospital and I need to go to skilled nursing facility care, if you look at the line that says skilled nursing facility care coinsurance and come over, that's that $204 a day that Medicare says I'm responsible for after day 21. The G plan is going to cover it at 100%. So I can stay longer if medically necessary, and my health insurance is paying that out-of-pocket cost. Under and maybe I need hospice care. That is also covered at 100%. I needed blood while I was in the hospital. Medicare says I have to pay back the first 3 pints. That's covered at 100%. I've been discharged. Yes, sir.
Where is that chart? I'm not finding it.
You're welcome. It is. Does everybody have it?
He's got to flip it over. Yeah. Turn it over.
It's right here. That's okay. That's okay. So now I'm going to the doctor for my follow-up care. Medicare says I have a Part B deductible. That's a calendar year. Come across, oh my goodness, that box is empty. Remember, I owe the Medicare Part B, $240. Once I pay that, Medicare comes in and says, Medicare Part B co-insurance or co-payment, 100%. So they're going to cover the 20% once I reach the deductible. Part B excess charge. The doctor says he does not like what Medicare is going to pay. He does not like that approved or assigned amount. So he can charge me 15% above that amount. And the G plan will cover it at 100%. Foreign travel. Well, I'm really not going out of the country, but if I did, my G plan would give me limited coverage while I was out of the country, about $50,000 in medical coverage. But if I do, I'm going to buy other insurance for that, for my travels. Now, G is the most common plan sold currently, but N is also a plan that a lot of people purchase. And the difference, you can see down the column, there's not a whole lot of difference between the two plans, but there are some asterisks where it says Part B co-insurance or co-payment. What does that mean? That if you took an N plan, you may have a copay of up to $20 at the doctor's office. Now, these plans come with a monthly premium on top of your Part B. On average, a male age 65 here in Lafayette is going to pay somewhere around the neighborhood of, I'm just going to say, about $130 to $140 a month. You get a little bit older, you're going to pay a little bit more. Female, age 65 here in the Lafayette area is going to pay somewhere around $115 to $120 per month. And unfortunately, as we age, our premiums will go up as well. So this is one way to fill in with original Medicare. Another way, to fill in could potentially be your insurance from your employer. We'll talk about that in a little bit more detail when Ms. Trish gets up here for a few minutes, but this is one of your options, okay? This does not provide you with prescription drug coverage. And the best time to buy this type of insurance, because you are subject to underwriting, is when your Medicare first starts, or you no longer are in this situation. And please, let me say this first and foremost. I am not trying to talk you out of leaving the Lafayette Parish school system insurance by any means. I am here to provide you information. But one of the ways to get this insurance, this Medicare supplement, would be you would have to leave your insurance, your school system insurance. You would have to tell Ms. Trish and them that you do not want it in any form or fashion. Then you would have a guarantee issue to get a Medicare supplement plan, A, B, C, F, K, and L, and G, and N, by any carrier, but you have to pay that premium. You will have 63 days from the day your school board insurance ends to take one of these. Otherwise, if you go out and try to get one today, they're going to ask you health questions if you are not new to Medicare. So my parents joined Medicare. My mom and dad are 82 and 83, so they got it at 65. So if they tried to take one of these plans right now, first questions that they're going to have to answer are going to be health. Do you have high blood pressure? Do you have diabetes? Have you been in the hospital in the last 30 days? Those are some of the questions that they're going to ask. And my parents are going to have to say, yes, I have high blood pressure. No, I do not have diabetes. And no, I have not been in the hospital in the last 30 days. They may or may not get this insurance. They are also 82 and 83 years old, so their premiums are going to be a lot higher than mine would be at 65. Food for thought, okay? And again, I'm not trying to tell you to leave. I'm just trying to give you your options so you, as the retiree, can make the decisions that you need to make that will affect your future. Now, in saying that, those plans that we looked at do not provide prescription drug coverage. So that's going to be another expense. So the sheet that you just looked at with the chart on it, flip it to the other side, and it's going to show your prescription drug plans for the state of Louisiana. So if you bought one of those Medicare supplements, you also are going to have to purchase one of these drug plans. You will see that your choices are limited. There's just a few companies, and that the premiums are all over the place. They start at $0 and they go up to $124 a month. They have basically a $590 deductible. Well, you got a lot of options, but how do I know which one is the best one for me? Well, it's hard to say looking at a piece of paper. So you would go on to Medicare.gov, answer a couple questions like your zip code, what are you looking for, prescription drug coverage, and then put in your medications and your preferred pharmacy, and it will cycle through the system and tell you based on your prescriptions what plan is the most cost-effective for you for next year. The good thing that I have to say, how many of you take Eliquis? And you don't have to raise your hand. How many of you take Xarelto? How many of you take Ozempic, Trilogy, Mounjaro, Farxiga, Skyrizi? Do these names ring bells with you? How many of you watch TV? Every single one of them I garnered off of TV. I call them TV medications. Yes, if it has a commercial, it's expensive. So those medications come in a pretty high price. And I'm going to pick on my dad again. So my dad's 83. He has a Medicare supplement and a prescription drug plan. He was healthy up until February. He was having a few little issues here and there, but in February, he got really sick. And I do his prescription drug plan every year. I look and make sure we got one that covers his medicines, put him in one. He got sick. His medicines now, we have spent over $6,000 since February on his medications because his plan does not cover one of the medications, so we're paying a lot for it, but he also is on a couple of those TV medications now, so they are high priced. So next year, we will cap at $2,000. The Medicare prescription drug plan will cap at $2,000. So the reason I tell you this is whether you go this route or you stay with the school system, your medication cost for 2025 will cap for prescribed medications covered under your Lafayette Parish school system plan, or if you decide to leave it, will cap at $2,000. The drugs have to be covered by Medicare, though, so that being one of the kickers. Any questions on this?
When you say cap, you mean?
That's the maximum you would. That's the maximum you would pay out of pocket. Yes, ma'am. So, like, I've helped my parents pay up to $6,000. Well, actually, we're at $6,342. I think was the last calculation. So next year we will stop at $2,000. He'll continue to get his medications, but we won't have to pay another $66,000. $66,000, not $66,000. Excuse me. We would all be bankrupt in that if that was the case. That is new, yes, ma'am. That goes into effect in January of 2025. That's part of the change to Medicare for next year and part of the Inflation Reduction Act. There's no cap this year. Well, about $10,000. Yeah, we don't have too far to go. $2,000. If you remember this year and the last few years, we've talked about deductibles and donut holes. The donut hole is going away, or let me rephrase that. The donut hole is capping at $2,000. As long as the drug is on the formulary, that is correct. Any questions? I got a little conversation out of y'all. Y'all aren't sleeping. Yay. Okay, so next type of insurance that we're going to talk about are these wonderful Medicare Advantage plans. You know, the ones you see on TV. You can't turn your TV on early in the mornings or late at night because there's a couple companies that like to hog the TV. So these are plans, these are what we call managed care plans, or Part C as in Charlie. These plans came about a few years back and are making headway across the country. And if you look in your handouts, you have one that looks, and let me see. No, I didn't put it in there. Looks like this. It says 2025 Medicare Advantage plans for Lafayette Parish. It's front and back. Yes, I apologize. The print's a little small. And I didn't think to grab y'all any magnifying glasses. I'm sorry. These are the plans. Now, you are not going, Ms. Trish is going to talk in a minute about a Humana plan that's offered to the retirees. That plan is not on this list, okay? This is for people that do not have an option to get retiree coverage from their employer. So I'm going to, again, pick on my parents who worked in private sector, did not get to keep their insurance into retirement, and have to get something else. So if you told Miss Trish, hey, I don't like the options that the school system's offering, I'm going out on my own, this is what you're going to be looking at, okay? So I'm going to walk you through looking at a couple just because I want you to have some basic understanding. But these plans, okay, are all very similar. They combine doctor, hospital, and prescription drugs all under one umbrella. And they also, for the most part, give you some of those other benefits that you've been looking for, the vision, the dental, the hearing, free gym membership, those types of things. That's what drives people to these particular plans. And in some cases, they will limit what you pay out of pocket. Yes, sir. Okay. Yes, sir. So the question was, I signed up, and I'm going to pick on my dad, okay? I signed him up for the Silver Script. No, I signed him up for a plan under a company called Clear Spring, okay? And they do not cover, or did not cover, one of the medications that the doctor prescribed to him. So what we had to do was file a formulary exception. And the doctor had to paint the picture as to why he could not take the drug that they had in their formulary. He tried it, but it did not do what we needed it to do. So the doctor had to paint the picture. And they've added it to the formulary for this calendar year. 2025, I'm going to be shopping for plans that do cover that medication. And if I cannot find one, then we're going to do another formulary exception to the rule. But every year, yes, under the Part D plan, you can change if you have just a regular Part D plan. Okay, so let's get back to these for a second. Now, one thing I want you to know when you look at these is that you still have Medicare, okay? That has not gone away. It is just that the plan is managing your Medicare A and B. They're kind of paying your bills. They've laid out a network for you to use, and they're kind of telling you, here's your doctors, here's the hospitals you can go to, here's what they're going to cost you when you go. and you're going to have a maximum out of pocket. So if you look on the front side of the page, and we're going to start with A, because we start with the first letter of the alphabet, Aetna, and the first plan on there is the Aetna Medicare Signature. You come across, I'm just going to go straight across the row here. It's an HMO, which means it's a health maintenance organization. So how many of you have driven down a one-way street? You can only go this way. If you turn around and go this way, you're going to run into somebody. And what's that going to do? That means that you're going to have a claim filed against your insurance premium's going to go up, and you're at fault. You're paying for that. If you make the wrong turn, you're paying for that. So what do I mean is that under an HMO, you have a one-way street. All of your doctors have to accept that plan. If you decide to jump over here and see somebody that's not in the network, you are paying 100% of the cost. Do you follow me? You are paying 100% of the cost of that visit or that test or that service. Next talks about the contract number. Then what? 0? Vicki, how can you give this to me for 0? Well, because I'm special. I told y'all I was special. I can do those things. So Medicare helps them offset some of the cost, and they know that what drives an individual is low cost. So they offer it at a 0 cost. Now, the maximum out of pocket, though, is $6,900. That's how much you would have to spend to not have to spend any more dollars in your health care for that calendar year. So I have a high deductible plan, and that plan says I have to spend $5,000 out of pocket, and once I reach that in a calendar year, they're going to cover any services I have for the remainder of the year at 100%. I reached that $5,000 this year, and so now I'm trying to run to the doctor's office every chance I get to get that free doctor visit, because it cost me $5,000 at the early part of the year. My primary care doctor, my PCP, is a 0 copay. My specialist, depending on what type of specialist I'm going to see, can be anything, anywhere from $10 to $35 per visit. Per visit. And when I go into the hospital, it's going to cost me $380 for days 1 through 7. If you stay longer than 7 days, they're not going to charge you after that 7th day. Okay, because you're paying it in the beginning, $380 per day. Now, if you have multiple admissions in a calendar year, every time you're admitted to the hospital, $380 a day, days 1 through 7. This one provides prescription drug coverage. Yes, it will cap at $2,000. It has vision that will allow you $175, dental, which will allow you up to $2,000, hearing benefit $500, and an over-the-counter benefit of $15 per quarter. And I forgot to put quarter on that one. I'm sorry. Any questions on that? Now, your vision, dental, and hearing, you will need to talk to the plan if that's what you choose to do, to make sure that your dentist that you like to use or your eye doctor who's in the network. And exactly what do I get with my exactly what can I not get with my $2,000 at the dentist office? Will it cover my braces? Probably not. Will it cover, I want veneers across all of my teeth? Probably not. Will it cover cleaning? Yes. Will it cover a filling? Yes. Will it cover multiple fillings? Just depends. Will it cover multiple extractions? Probably not. Will it cover a bridge? Probably not. Will it cover an implant? Probably not. Do you see where I'm going with this? Probably not going to work for you at the dentist office. Do you want dentures? Sure. Are they going to pay to pull all your teeth for $2,000 and put dentures in your head? No. So when you look at these benefits like this, you have to think about those types of things that you want and then decide whether or not it's really what you want, because some of those you're not going to get through that. And yes, ma'am, you had a question.
Yeah. So this line takes the place of this.
Replaces that, yes.
Replaces this, so this is no longer in play.
You have it, it's just Medicare's not paying those claims. Aetna's paying when I go to the hospital.
So all of this is just moot, and you follow this.
This goes in the back pocket, and this is what is in your checkbook that you pull out every time. Yes, ma'am.
But when it says you have zero premium, they're not talking about you no longer pay your Medicare.
Correct.
You're still paying Medicare.
You still pay a Part B. You just do not have to pay Aetna every month for that particular plan. Now, you'll see that the next one talks about PPO, preferred provider. Okay, and that just means that I can make a turn if I'm on that one-way street. I can go left or right, but when I do, I'm going to pay a higher out-of-pocket cost. So preferred provider means you have a preferred provider, but you can gravitate in another direction if you choose. However, if you choose to gravitate, your out-of-pocket cost will be greater. So when you go across that line, we're going to skip that column that says give back. I'm going to come back to that and look at the next one that says out-of-pocket max, where it shows $6,750 or $10,000. If all of your doctors are on the straight and narrow, they're in that preferred category, it's $6,750. But if you've gone to the left or the right and you've seen doctors that are not, then you're looking at that $10,000 out-of-pocket maximum. If you go to a primary care doctor in this example that's not in network, it's $5. If it's a specialist that's in network, it's $35. If they're out of network, it's $50. So you can see everything on the right of the slash is out. Everything on the left is in. So you try to stay on the left side of the road, not the right side. However, a lot of times that left lane is my passing lane. Get over in the right when I'm coming. No, I'm picking. Now, in that column that says total monthly premium, let's go back to that. It shows zero, and it says $85 give back. That does not mean that I'm going to give you back $85 in your bank account every month. That means that I am going to pay, as Aetna, $85 a month towards your Medicare Part B, as in boy, premium. So ultimately, when Social Security makes that deduction every month, they're not going to take the full once whatever the premium is. Let's say it's $185 next month. Social Security will only deduct $100 out of your check, and Aetna's going to pay $85 towards your premium. Y'all follow me? Yeah. Now, you will still have Medicare, okay? Don't think it's going away. But if you choose one of these plans, they are managing it. They are paying your claims. They're telling you what to do, okay, and how to do it and what it's going to cost. But ultimately, you're not giving it up. It goes, as I said, in the back pocket, and everything that you need will be in the front pocket on that card. It will be the only card that you will truly need to use for your hospital, your doctor, and your drugstore. Now, let's talk for just a second, because I'm winding up, about a couple things I want to go over with you. You have a couple other pieces of material in your packet, because you've gotten a whole lot. So there is, in your packet, some information about the differences between original Medicare and Medicare Advantage plans. Read this when you're at home, when you have nothing better to do, or one of those commercials comes on TV. You can read that, and it will answer a lot of the questions that you may have. But you also have a brochure in your packet that looks like this. When you open it, it looks like what you see on the screen. This is a brochure that talks about trying to help individuals on a fixed income, limited income, help pay for their Medicare Part B, as in boy, premium, and or reduce their out-of-pocket cost for prescriptions. These, God bless you, these are programs on the right side, the dark heading, Medicare Savings Program. These are programs that would pay your Medicare Part B as in boy premium, but you have to meet the income requirements. The plans on the left side or the light heading are the low-income subsidy program, and they will help with your prescription drug cost. So if you focus on the right, it talks about qualified Medicare beneficiary, specified low-income Medicare beneficiary, and qualified individual. And you will notice the income limits. So for a household of one, it's just me in the home, just me. My total gross income, everything coming into the home, is less than $1,255. Then the state, the Medicaid program, may help pay my Medicare Part B as in boy premium. If it's my husband and I, and our combined income is $1,704, and these are gross amounts, then they would help pay both of our Medicare Part B premiums and possibly help pay the 20% when we go to the doctor. Now, if our combined income is $2,300, it will help us with our Part B premium. On the light side or the left side, if our income, let's say as a couple, is $2,400 combined, then we would qualify for the low-income subsidy to help offset the cost of our medicines. So that Forxiga and that Mounjaro and all those other TV medications that are so costly would be capped for me and my husband at roughly $12.15 a prescription. But we don't have a whole lot of money coming into the home, so that helps greatly. So this is just an assistance program and a resource. It may not affect everybody, but you may know someone. So if you do, please tell them about this program. Couple key points for you to remember is that Medicare's health insurance, you're going to have some decisions to make in the next few days. Whether you stay with the school system, whether you leave the school system, it is your decision, but you will have to make that decision. And if you don't make it timely, it could have a negative impact on you. There are some resources available for you. Just ask, and we will be glad to answer any of them. Right now, is the yearly open enrollment period, so that's why you're being bombarded so much. Everybody knows that you are of Medicare age, and we want your business, so we are bombarding the heck out of you. We will stop after December 7th. However, some of you may get it because you're not quite 65, so when you turn 65, we're going to bombard you again. But that just happens yearly, but everything that you do during this time frame will take place on January or become effective January 1st. Now, how many of you got this wonderful book in the mail? Pretty much everybody. If you didn't, there are some copies out on the table. Please take one. And the main thing I want you to take away from this is if you have this book at home, it should have your name and address on it and not my name and address on it. But it will have my phone number on it. So it says, this handbook has special information for Louisiana. Please feel free for free counseling to contact the Louisiana Senior Health Insurance Information Program at 1-800-259-5300. I promise if you call that number, you are calling Louisiana. Not India, not China, not any other country, but Louisiana. It will ask for your zip code, and you will either get routed into my office or you may be lucky enough to get routed to the Cajun Area Agency on Aging, which Miss Doty's in the back of the room. She is a local me for this area, and she will be glad to sit down and talk with you. Her office is at 110 Toledo, and her phone number, for those of you that would like, is not on here, but we will get it to Miss Trish so she can add it when this goes live out on the YouTube page, and she sends it out to everybody. We will add Miss Doty's number to that, but her number is 337-572-8940. Again, 337-572-8940. But feel free, Miss Doty will be here for a little while. You are free to ask her any questions or talk with her at any point. Here is my contact information, but again, you can reach me by finding your book and calling that number on the back. With that, you got a lot of information. You've got some decisions to make, but we're going to take a break, and we're going to come back, and Ms. Trish is going to talk to you about the decisions and the options that the school system is going to offer you. So stretch your legs, clear your brains, and get ready for some more.
All right, everyone, y'all ready to get started? I don't think I see anyone in the lobby. Figure we just talk through perhaps, I'm going to keep it real informal, okay? I know you've been receiving a lot of communications. I know it can be overwhelming. I know it's hard to figure out where you are in the scenario. We have over 2,700 Medicare A and B members, so we have a department of 7, and we're currently working through both active open enrollment and retiree open enrollment. So I appreciate your grace and your understanding is what I'll start off with, because each individual has their own questions. We know you're trying to look for answers, so if you would be just a little bit patient, leave us a voicemail or an email if you want to try and connect with our office, and then we're going to reach back out to you. I'm going to call it dividing and conquering is what I'm going to call it. So a lot of members are very familiar with Miss Ashley. She's upstairs right now working. I was going to bring a few staff members down to at least try and introduce them at the end. But if for some reason you're trying to connect with Ashley, Ashley cannot do it all. So you'll likely hear from another staff member who is familiar with what your questions are and will be happy to answer them. You may likely hear from me too. My name is Trish LaBeouf. So just feel free, give us a little grace. We will reach back out to you. We're just trying to connect with everybody. In addition to open enrollment, we have everything else going on too. But I wanted to just make it real informal. So if perhaps you have some questions, feel free to raise your hand. I'll repeat the question. That way everyone can hear it inside the auditorium, and we can make sure that it's recorded, because I am going to send this video out to all of the retirees. That way they can take a look and listen to the information that was provided today. But if you received the LPSS packet, is how I'm going to describe it, with the LPSS logo on it, I'm just going to walk you through the initial open enrollment communications that we sent out to retirees. So it's got the beautiful building of our new location about a year or so ago. Okay, so I'm going to just start with the first page and just talk you through. I'm thinking a large majority of everybody in here is probably under our Blue Cross plan. Am I thinking that through correctly? I see some nodding heads. Okay, retirees of the district, or perhaps your spouse is on with you. So the couple of the questions I got asked during the break is, Trish, what if we don't want to do anything? What do we do? Okay, so if you want to stay with the district, LPSS Blue Cross insurance, there's nothing you need to do. That insurance is going to roll over to 2025 like normal. Now, there is going to be a premium increase for Medicare A and B members, okay? So if you or your spouse is on Medicare A and B, you will have a 50% increase in premium effective January 1st. So A, if you're on our insurance, you still want to keep it, you love your Blue Cross, you can keep it. However, there will be a premium increase effective January. You'll see that increase through your pension. We'll make those changes for you. It will automatically happen. And you'll see that increase in deduction on your January 1st, 2025 deduction from your pension. Okay? So A, if I don't need to do anything, we don't need to hear from you. Okay? It's just going to roll over, and your premium's going to increase, and everything's going to happen like it typically does anytime the board approves a premium increase. Okay? So I tried to detail out the things that you have options under, because I don't know your individual circumstance. Everyone in this room could be in a different place. So I'm just going to walk you through the options that are available to you so that you can make the best decision that you need to make. So you could keep the policy under your Blue Cross. You could change plans. Now, I'll put a disclaimer right there. If you are under Medicare A and B, you have our basic PPO plan, okay? For Medicare A and B members, you cannot change plans. You have to coordinate and be under the basic plan, okay? So if I'm under A and B, I cannot move to the high deductible. I cannot move to the enhanced plan. Let me give you another scenario. I did see a few hands in here where members were not age 65, which tells me you do not have Medicare A and B. Maybe I am under the enhanced plan and I want to transition to the high deductible for a lower premium. In that example, you could, because you do not have Medicare A and B. Does that make sense? Otherwise, if you are a Medicare eligible member, either you or your spouse, we typically have couples. We do have some members who do have dependents. Maybe they have a disabled dependent on the plan too who has Medicare A and B. So in that example, we may have 3 members with Medicare A and B. But typically, we either have a retiree only or a retiree plus a spouse under our plan. So just know if you have A and B, you have to stay under the basic, and the premium would increase by 50%. So his question was, what happens if I have, let's just say a husband and a wife under the same plan, under the basic, one of them has Medicare and the other does not. If any member has Medicare, you're subject to the 50% increase. Because you're receiving a Medicare discounted premium right now prior to the 1125 changeover. So because of that, it's affecting any member to include the husband or the spouse or perhaps the member, the retiree, and the dependent, the eligible dependent who's under Medicare A and B. Anyone that has the Medicare A and B is getting that 50% increase. Make sense? Yes, ma'am.
Yes, I have Medicare for A and B, but my husband signed up at his work,
Okay.
He signed up for Medicare for A. That's it. And then I signed him up for Blue Cross Blue Shield.
He's under our plan, ma'am, Miss Rosemary?
Yes.
Okay. See me afterwards. There's a lot of ifs, ands, or buts to that scenario based on whether the member's working, based on whether you're retired. So hang tight, and I'll answer your individual question. Okay. So keep the plan, change the plan. We went through that one, or cancel the policy. So right now, you're in an open enrollment period. This is your opportunity to make any one of those changes. Stay the same, make a plan change, or perhaps cancel your coverage with LPSS. So I'll just put a couple disclaimers out there. If you cancel the coverage with the district, you will not be able to return, okay? There's stipulations. It's written in every single plan document. We make our plan documents directly per OGB. It's very similar to the Office of Group Benefits. Anytime you leave any one of those policies, LPSS has a similar one. You cannot come back to the district insurance. So we'll make sure that anyone who is wanting to cancel understands that. We make you sign on the dotted line. We make sure that you fully understand that, because I wouldn't want you to make a decision thinking perhaps the grass is greener on the other side. You get on the other side and it's not what you were hoping it would be, and you wanting to come back, because then you will not be able to. Yes, ma'am.
But you're not saying if you switch to Lafayette Parish School System's Medicare Advantage.
Very good point. Yep, you beat me to the punch. Her question was, so I'm going to call it toggling back and forth. LPSS has 2 plans available to Medicare A and B members, retirees of the plan. We have the Blue Cross, which you're all familiar with, and we also have the LPSS Group Humana plan. Okay, it's a Medicare Advantage plan. It's specifically to our retirees. It's not an individual plan like Ms. Vicky discussed earlier. It's specific to the district. So her question was, you're not referring if I perhaps cancel my Blue Cross with the district and I go under the LPSS district Humana plan. That is correct. We allow you to go back and forth between the two plans. You can only do it during open enrollment, what we're discussing here today. I made a disclaimer a few minutes ago. Open enrollment deadline ends on the 22nd of November. November 22nd is when the end date is. That's when your decision needs to be made. If you're wanting to perhaps cancel the coverage altogether, leave the district, maybe you want to change plans if you're not Medicare A and B, or perhaps you want to cancel your Blue Cross coverage and instead take the district LPSS Humana Medicare Advantage plan. So I'll preface that too by saying that you can go back to Blue Cross. However, you have to stay under the LPSS Humana plan for the entire year, wait for the next open enrollment period, and then we could have another conversation kind of like what we're having here today, and you could go back to the LPSS plan. So I call it toggling back and forth between one of our plans to our other. You just have to adhere to the deadlines. You have to adhere to the open enrollment period. But yes, the district does allow you to do so. Just know when you jump in with both feet, you're in it for a whole year until we have another conversation during the next open enrollment. Does that help? That help? Okay. So, let's see. Yes. Okay. Yes, sir. Good. Okay. So his question was, what happens if I'm under the Blue Cross plan? Okay. I do make the decision to transfer and cancel my Blue Cross and go under the district LPSS Humana plan. Key pieces. Every single time I'm going to describe them, I'm going to put the LPSS in front of them. When I go back, let's just say I do want to go back the following year under open enrollment back to the Blue Cross, LPSS Blue Cross plan, will I have any type of medical underwriting? Because that's a key point, right? No, sir, you won't. There's not any. Now, it's a different scenario if you leave the district. Ms. Vicky did mention those 63 days once you leave the district. But if you're going back and forth between our plans, there's no consideration of whether you've got medical issues. We don't limit you on any type of medical or pharmacy concerns that you're currently having. You simply cancel one coverage and head back to the other one, both of them being the LPSS plans. Makes sense? Okay, awesome. All good questions, very good questions, because I guarantee you someone else had that same question. Okay, so what is new this year that I think has been causing the most grief is how I'm going to describe it. It's something new to us. It's something new to you, so I could understand where there may be some confusion. Typically, the district has required, I'm going to use the couple example again. I have a husband and wife under our LPSS Blue Cross plan, and we've typically required that you and your spouse be under the same plan, no matter what. Sometimes, like, I'll use me as an example. Let's just say I'm a retiree of the district. My husband is older than me. He's going to hit age 65 before I will. If I'm currently retired, he would have had to wait until I turned Medicare eligible age before we had options with the district, okay? We're recognizing that you and your spouse may have different needs, and you may want to do something different than what the spouse is doing, okay? So in that example, let's just say he turned 65. I'm a retiree of the district. I'm under age 65. I do not have Medicare. My spouse perhaps wants to look at Humana and go under the Humana plan instead of staying under the Blue Cross plan. We've created what's called some hybrid chart in premiums this year, okay? That allows members in those examples to split, and he try one plan, I try another plan. So in that example, let me give you an example. Let's use, I'm going to start from the beginning, and let me try and pull it up because I'm a visual person. I like to see it in front of me. I'm going to pull up my other chart that we sent out this week that may have caused some confusion. Let's just start with the first page. I'm going to blow it up and give you your options. So let me just start with the retiree-only example, okay? If I'm a retiree only of the district, I have a couple choices. I could stay under our Blue Cross. Currently, I'm paying $110 if I have Medicare A and B. You're not going to have this in your packet. I see a couple of y'all looking. But it's what was emailed out to you last Friday, okay? I can certainly print a few if y'all need some once we get done. But it was emailed out on Friday, this past Friday. I'm trying to remember what day it is. But retiree only. So if you look at this, this starts how your options come about. If my current premium under Medicare A and B, if I'm a retiree only, is $110, effective January 1st, my premium will increase to $165. It's that very first line item at the top. I could stay under Blue Cross, and I'm going to see the increase of the $165. Or I could go to the LPSS Humana group plan and pay a zero monthly premium. Keep in mind, I know Ms. Vicki went back and forth to it throughout her presentation, you still have to pay your Medicare Part B premium. Right now it's $174 and some change. I likely see that increasing too. They typically increase from year to year. I don't remember, they are not increasing for 2025? Okay, they have not released 2025 numbers. It could stay the same or it could increase. So this is just solely your Blue Cross premium is what I'm presenting up here. So keep in mind you still have to pay your Part B, be like boy premium. Okay, so let's go back to the scenario where me and my husband, when I spoke a few minutes ago, if I'm a retiree of the district, that would be the next line item. The retiree plus one with Medicare A and B, okay? That would be me. I'm younger than him. He has Medicare. So if we stay under Blue Cross, our current premium under that B1M rate is $345. With the 50% increase, you're going to increase to $518 come January 1st, okay? So we try to give you some options. Stay under Blue Cross. That's your option. You're going to see that increase to $518. You could, the Medicare eligible person could go to the Humana plan, okay? Depending on who that person is, if it's the spouse is going to be charged $49. If it's the retiree, it's $0, depending on who has the Medicare. And then the member who's left, if they decide to stay on Blue Cross, they would pay the employee or the retiree only rate. So that's where your confusion's going to happen because your scenario could be specific to you and we don't necessarily know which member has the Medicare. Does that make sense? So if you follow it all the way across, it basically states what I just noted. The Medicare eligible retiree would pay $0 if that's the member. And then the dependent could stay under Blue Cross and they would be, depending on which plan they're in, there's a lot of scenarios here, they would pay that employee or retiree only premium. Same scenario, the Medicare eligible spouse moves to the Humana plan and pays $49, and then the other pays the retiree only premium. So we're trying to give you just a few options so that you know that the increase is a lot. We know that that could be a financial hardship. So by presenting you some options, it at least allows you to think what LPSS has available for you. And maybe the other scenario may work better for you if you're willing to take that leap of faith and try it. Yes, ma'am, I saw your hand.
Now, are we still PPO or HMO?
You've always been a PPO. Her question was, are we a PPO or a HMO? You've never been a HMO. In either example, the Blue Cross plan is a PPO, and the Humana Medicare Advantage LPSS plan is a PPO. Okay? None of them are HMOs, kind of like, remember when Ms. Vicky said that one-way street? You don't have a one-way street in either of those scenarios. Okay? So where I see where we're having a lot of the questions is when we get to the hybrid scenarios. It typically happens when I have 2 or more individuals on it. If that's you, send us your communications either by phone or by email, and we'll help walk you through those scenarios and tell you what you have available. What I'm also going to ask that you do, too, is we cannot tell every single member their current premium. That's a lot of members that we have under the plan. Please look it up under your pension system. You either have teachers' retirement or you have Louisiana School Employees Retirement. They can be reached either by phone or you do have access to an online portal, but you got to create a login in order to look at that information. You typically get an annual statement at the minimum from the pension system at least once a year. I would recommend that you just stay connected to your pension just to make sure the correct amount's coming out your pension, everything's good to go. But I wanted to at least introduce it to you and tell you, we do have, the chart is long depending on the scenario, because we have members who both work for the district, like we call those double LPSS employees. We have retirees. We also have members who have more than 1 or 2 members under the plan in that scenario that I described where we have a disabled dependent perhaps, or maybe you took retirement at an early age and perhaps you have a 22 or 23-year-old under the plan. It doesn't necessarily have to be a disabled dependent. We've got a lot of scenarios and everybody's in a different scenario. Okay? But I at least wanted to tell you that. I'd be happy to provide some printed information for you. I'd be happy to answer individual questions if I need to with regard to it. Just give us a little bit of grace and we'll email it back to you or we'll provide it to you via phone. That way you have the information. So I'm just going to walk you through. I don't think I have any Humana members in here. You do? Okay. So Humana members, nothing is happening with regard to your plan. It will roll over like normal. The board did not approve any type of changes with regard to premium to your plan. No benefit changes. The board may entertain perhaps adding some value-added benefits at a later date, but for 2025, they did not add anything for a change. So just know status quo, everything's still the same premium, same plan offering, same benefits available to you. It will just roll over. You could cancel, I'll give you the same spiel that I mentioned before. You could cancel your Humana coverage and go back to the Blue Cross plan. However, you'll fall into that increase of the 50% premium. Okay. Yes, ma'am.
Okay, just one question. If we have Blue Cross, and we want to change plans, we have to fill out an application for Humana and cancel Blue Cross, so there's 2 things we have to do.
I'm going to walk you through that. That's a good point. Hang tight just 1 second, and I promise I'll get to that answer for you. And then I'll recap it for you. Okay, so there's the ladies that make the wheels turn. Yes, ma'am.
I wanted to clarify, when you asked about the PPO, so if the PPOs for Blue Cross are going to carry over to Humana, your preferred physicians should be the same, correct?
If I think I'm understanding your question, correct me if I'm wrong.
You should be able to use the same doctors.
Not necessarily between the Blue Cross and the Humana plan. Is that what you're asking, ma'am?
Yes, but then if they don't, then you just have to request that your doctor
I'm going to get to that piece too. It sounds like, so her question was, what happens if my physicians and my facilities that I see under Blue Cross, if they're not covered under Humana? So I'm going to hit that piece in just a second. Y'all all got good questions, so hang tight just 1 second. So that is staff. We have a department of 7. Y'all typically know Miss Ashley Wright. She's typically your point of contact. She's the retiree specialist. But that is our telephone numbers. Again, phones are ringing right now. Just leave us a detailed message. The more details you leave me or leave Ashley or whomever you're calling, I can pull up your information before I ring your phone. I have a general idea of what you're under. I kind of know what I think the questions you're going to ask me. And then I'm better prepared to answer your questions and get you off the phone and point you in the right direction. So leave me some details. That way, rather than just saying, hey, my name is Trish and I have questions about insurance. That doesn't tell me a whole bunch. Just give me some details, some meat and potatoes is how I'm going to describe it. And then by the time I get you on the phone, I'm already well prepared as to what I need to tell you. So that's just insurance's point of contact. I don't know if y'all know this, but Blue Cross Blue Shield changed to Louisiana Blue. That is their new name. Same benefits that you had before. They just did a rebranding. They're now Louisiana Blue. So when you start seeing that, your insurance did not change, okay? Still the same Blue Cross Blue Shield that you had before, just a new logo. New name, new logo. So, group Medicare Advantage. The lady in the back asked a lot of really good questions, so let me try and detail a few of them right here, and then I'm going to redirect you. Let me get to that page real quick, and then I'll answer that question. Okay, so Humana, that's the LPSS Humana District Plan, okay? If you're going to transition from our LPSS Blue Cross plan to the Humana plan, a couple steps do need to happen. We tried to make it as simple as possible with some steps within that booklet, that packet that you received. Anytime we have members transferring from our LPSS Blue Cross plan to the LPSS Humana plan, I ask you to do one thing for us. I don't want it to be a poor decision for you. I don't want you to get on the other side of it and enroll with Humana within our plan and your doctors not be covered, your medicines not be covered. It's important that you call customer service first. I'm going to ask you to round up all your prescription information, round up all your facilities and your doctors that you currently see. And I'm going to ask you to connect with customer service first, Humana customer service. You're going to tell them, we have the group information listed on that other one. I'll refer back to it real quick. You're going to tell them you're an LPSS retiree. It has our group number, 303561, on there. You're going to tell them you're a retiree of the district, and then you're going to ask them your individual questions, okay? I want them to vet and get into the weeds is how I'm going to describe it, and for you to ask those personal questions with the Humana customer service. That way, I'm positive, and I feel more comfortable should you want to transition from the Blue Cross plan to our district Humana plan. So there's a customer service number. Just remember to mention the group, okay? Now, the booklets. Humana is mailing out booklets to every single member who has Blue Cross with us, okay? I believe they mailed just the other day. They should be hitting your doorstep in the next couple days. You should have them by the end of the week or first part of next week, okay? I like stuff that's in front of me. That way I can read it. I can visually make notes on it. So it's going to come to your doorstep, and you're going to be able to take a look at it and research it further, okay? So A, we call customer service. B, you're going to take a look at your book if you're interested in the plan. We have finalized the details of the educational workshop. It's going to be at the Picard Center, UL Picard Center, on November 12th. There are 2 times that you could come and learn some more information about the plan. It's not going to be a time for you to ask those individual questions, which is why I wanted you to connect with customer service first. That's the place to ask your specific individual questions. But they're holding an educational workshop. There's going to be 2 on that day at the Cecil Picard Center. Let me pull up that other one real quick so you can visually see it. So and within that booklet, this was the communication that we sent out on Friday. That booklet's coming to your doorstep. It's going to have this information in it, okay? There's a 10 a.m. to 12 p.m. workshop, and then there is a 2 to 4 p.m. workshop at the Cecil Picard Center. They're going to offer the exact same thing. You don't need to go to both. Yes, sir? I will not. His question was, if I cannot attend, will there be a way that I can see it? I don't have a resource to tape it at the Picard Center. We do have Humana educational sessions that we've done that the IT has taped for us, but they're about a year old. It has about the same material. I can always send you that information if you'd like to watch it from the YouTube ones that we've taped previously. But no, sir, I won't have an option to tape it over there, which is why I wouldn't have been able to hold, it holds 185 people. So we needed it to hold more individuals because of the amount of sessions. But if you're interested, there is a registration number. Just call that 1-800 number, tell them that you're interested, tell them which workshop you want to be a part of, and then they'll put your name down. So that's going to be in the packet that gets mailed to you. Be on the lookout for it. That way you can physically have it in your hands and you can take a look at it further. Okay, let's see. So I'm gonna hit the Humana pieces and I'm gonna go back to the Blue Cross. Okay? I'm gonna make sure that you know both. I'm not trying to encourage one way or another, just trying to give you the information. That way you have it at your fingertips. So if you are interested in enrolling in our LPSS district group plan, okay, you're going to have to cancel your Blue Cross. When I say cancel, keep in mind that policy will be active until 12/31, okay? We're not immediately going to cancel it for you. You just need to fill out the paperwork for audit purposes. That way I've got your signature, and we've had a couple conversations by canceling the Blue Cross. It's going to require that you enroll in the LPSS Humana plan, okay? We have 2 resources available to you because there's over 2,700 retirees. Our office cannot do it. So I've got Humana assisting us with the effort, and there's a call center where you can physically talk to a live person on the phone. It's not going to be, as Ms. Vicki mentioned, it's a local person from the state of Louisiana to help answer your questions, okay? And then they can physically enroll you into our plan. That window will not be open until November 4th through the 22nd of November. So, A, you're going to get your booklet in the mail. It's going to allow you to make a call to customer service to ask your individual questions. I want to make sure you're fully ready to enroll. I don't want you jumping into it without asking those questions first and getting those answers that you need. I want you to feel comfortable with whatever transition you decide to do. So essentially, you would call or do it online. There is going to be a resource for you if you prefer to do it online. I'm thinking I like to talk to somebody. I would probably call the number if I wanted to. So we do have, in order to manage the large number of retirees who could cancel, we've offered some opportunities at district in order to cancel your insurance under Blue Cross. So we're going to make sure that we're getting the enrollment information from Humana. I'm going to know if you enroll in Humana and we don't have a Blue Cross cancellation on you, okay? I would prefer you connect with us versus us having to connect with a large number. But I've provided some opportunities to where staff would be available. It's not an opportunity to do a half an hour one-on-one conversation. I can't do that because we've got a lot of members that may have questions. However, staff will be available here at the district office in room 2010, which is up on the 2nd floor. Should you want to cancel, you could also do it online. You can print the form, you can sign it and cancel the insurance, you can take a picture of it and email it to us. We can email it to Ashley. Ashley's information is listed on the form. But I got to have a cancellation under Blue Cross, and then you're going to have to enroll under Humana if that's your scenario. Okay? So let's go back and hit a few of the things that we didn't get a chance to talk about. So let's talk about the Blue Cross members. Remember, if you're not going to do anything, you don't need to make a change, you don't want to take any type of action, you're going to roll over to 2025 and everything is going to be the same except for your premium. Your premium is going to increase, okay? If you want to cancel or change a plan, we do need that in writing. We do have forms. The forms are listed in the clickable links in the emails that were sent out, which is on the next page. The information in the blue box tells you the cancellation form or the change form should you need to make it. If for some reason you prefer to do it and fill it out and then email it. Otherwise, if you want to come by district, we do have those other times available for you and we can help walk you through the process. So let's go back to the Blue Cross so everyone understands. That just tells you the information for Ashley. It's got Ashley's point of contact if you wanted to email that form. It gives you the address of the district office, the 202 Rue Iberville. And then it tells you the date and times that are available to you. I am willing to add some additional times and dates if we have to. We're just trying to manage it the best that we can so that we can help every single member. I know that sometimes it's probably going to take some time to talk through your questions. If you've got that scenario, let's talk through them prior to you coming, because I don't know that I'll be able to devote half an hour or 45 minutes specifically to you because I only have 7 staff members. But reach out to us. We'll connect ahead of time, and then hopefully you'll have all those questions answered, and then it would just be a matter of dropping off your form if that's the case, if that's the route that you wanted to take.
And the form is online, or it'll be in that booklet?
It is online. She asked about the form. Where's the form? So if you keep going within this packet, the form is listed up there in the blue boxes. So if I clicked on it, look, let's click on it, and I'll show you what it looks like. If I click there, it's going to open up the form. And all I have to know is your personal information and that you're canceling it and then signing and dating the bottom. Okay? We'll have a staff member on property during those time periods here at the bottom. Look, let me blow it up. Like we had one this past week, I did have a few members come through and make changes to their plan. The next one that we have is actually tomorrow from 9 to 11 and 1 to 3. If you just come in and you tell Ms. Judy that you're here, the room is up on the second floor in room 210. And I will have a staff member available for you. We'll have a couple, depending on how many people are there. And then we can help walk you through that cancellation or perhaps that change. If you don't want to do anything, then we're status quo. I don't need anything back from you. Yes, ma'am. Yeah, not one-on-ones. Unfortunately, we just cannot do one-on-one 45-minute conversations. Ma'am, I'm sorry. No. Okay, so her question was, there's no appointment that needs to be made. You're correct. You can drop in during those time periods. So tomorrow from 9 to 11 or tomorrow from 1 to 3. I've tried to give you several dates and times during different times of the day to try and accommodate. And if we notice that there's a large influx, I'll make sure that retirees know that we've got some additional dates and times available for you. We're just trying to gauge it. I don't know how many people may be wanting to make change. I don't know if people are just going to stay with their Blue Cross or perhaps they will try that transition under Humana. And with 2,700 members and 7 staff members, it could be a lot. which is why we're trying to come up with some additional resources available for you. Okay. So keep in mind, remember, within your packet, that's where your premium information was. So the pre-65 members, let me click on it and I'll just give you a brief rundown. Let me blow it up on the screen a bit. We had to wait for the board's direction. There was some clarity that needed to happen, which is why you waited for us for about a week. And so if you fit in this category, which I don't think there's a lot of people of when we saw the hands earlier, I'm pre-65, so I'm 55, 56, 57. I'm under the age of 65. I'm non-Medicare eligible, 65 or older. Maybe I've worked for the school district for forever, but I never got my A and B. If that's you, this is your premium chart. If I have Medicare Part A and no B, or perhaps Part B and no A, or maybe I'm a retiree return to work. This is your chart. So I need people to be perfectly clear as to where they fit, because if I just say retiree, there's a lot of different retirees here at the school district. It's non-specific, which is why we needed to provide clarity to the retirees of the district, not only to y'all, but to the board. So probably moving forward, there will be a long answer to that question. What type of retiree are we discussing? Because on my other chart, those are my 65 and older with Medicare A or B, whether you're a member, a retiree of the district, or a spouse of the district. Okay? But if you happen to fit in this category, let's just say you're 67, and maybe you have A and B, but you're back to work. You fit on this chart right here, but you have to be back to work with the parish, LPSS specifically. Can't work for the charter school or the parochial school or whatever. Has to be with LPSS, the district. We do have several members like that who have retired with the district, but they decided to come back. So if that's them, then they're falling on this particular chart because they're actively back to work, essentially. Okay. So, and then I'm thinking a large majority of everybody else is on the next chart. So hang tight 1 second. We'll get that one up and we'll take a look. Okay, so I tried to put the Medicare card there to help identify. That's members with Medicare A and B. This is your chart, and it does include the 50% increase. So that's the new total. That's why we tried to create that other communication that went out to you on Friday so you could see what your current rate is, what your new rate would be with the 50%. Okay? This just tells you what your new rate is going to be. So if you look at the top line item, the retiree only with Medicare A and B, that's the member that's currently paying $110. $110 with an increase to $165, that's the 50% increase. Okay? Okay. Let me see. I'm sorry, I didn't download it, so it's bringing us back to all this. So on the first communications that went out, keep in mind there's a lot of clickable links. There's a lot of information. Sometimes it could be information overload. But you literally have several links that could take you directly to your questions that you're wanting answered. Or there's the Humana customer service line that can help answer those specific questions. I'm going to pause there just for a second and remind you, if you're a retiree of the district, remember, if you transition to the Humana plan, it's a $0 premium per month. If it's you plus a spouse, it's $49. And then if you've got 2 or more all Medicare eligible, that's $98 per month. So keep in mind, I know you're probably pausing there going, why is that premium 0? Okay, the district does pay for your premium. Keep in mind they pay for your Blue Cross portion of your premium too, okay? So they're contributing on both of those policies, both your Blue Cross and your Humana. It's just that the Humana policy costs the district less, which is why they're passing on those cost savings to you. Makes sense? Okay. Because that's typically where I get a lot of questions. Trish, why is it 0? There's got to be a reason why it's 0. Because what's happening is when you stay under the Blue Cross plan, your medical, your pharmacy, everything is processing under our claims and billing. When you transition to any type of Medicare Advantage plan, just like when Ms. Vicki was talking, you transition to a fixed cost that gets an additional supplement from CMS, which is Medicare, okay? And then that drives the cost lower. So that's why there's a difference in the premiums between your medical, your pharmacy, and your medical and pharmacy coverages, in addition to all the fixed costs associated with you under the Blue Cross plan. That has a higher impact on our self-funded plan, which basically means that the district pays for your insurance. They pay for all your claims and billing that process through. Whereas when you're under a Medicare Advantage plan, with any Medicare Advantage plan, there's subsidies from CMS that get reimbursed. And based on that, you turn into a fixed cost where it's $200. I'm just trying to give an example. $200 fixed cost versus under Blue Cross, all your medical, all your pharmacy, all your other fixed costs are all processing through the plan. So it's much more costly for the district, which is why your premium's more. Does that help? It can be confusing. Yes, ma'am.
I have a question. I travel a lot, and I'm in Florida like 5 months out of the year. I know that this was created for Lafayette Parish. My question is, how acceptable is it in other localities, other states, other countries?
Okay. So her question was, I don't always spend my time here in Louisiana. I do like to frequent Florida, which sounds wonderful. So is that universal? Can I use this coverage under Humana in other locations? You can. It is a national coverage. Your Blue Cross is both national and international. Humana will cover you internationally in the event of an emergency. Keyword there, okay? I suggest anybody who's traveling internationally to get that additional protection, travel protection insurance, because even with Blue Cross, it can get really sticky when you're in a different country, even though you may have insurance with us, with the district, and it's national. But yes, ma'am, they do. That would be a good question to dive deeper into customer service, but Humana is covered throughout the United States, and our plan is accepted anywhere within the U.S. Yes, ma'am.
Pretty readily accepted here because they will be familiar with it. But in Florida, or other places, they are not familiar with our plan.
It's still the same.
Okay.
You still have Humana coverage throughout the United States. Yes, ma'am. Okay, and I'm on my last slide. I know we went over, y'all. Hang tight just 1 second. So let's see. So I just wanted to make a couple disclaimers. That was in the packet too. So your silver scripts, if you have Medicare A and B, you have silver scripts, which is your Part D, like David, prescription coverage, okay? Remember, you have A, B, plus the Blue Cross. This is your D, like David, for your prescription coverage. Silver scripts is increasing on their deductible. You currently have a $100 prescription deductible with silver scripts. It's increasing to $250 January 1st. Okay, so you'll have that additional cost under silver scripts too. For those members who may be under the high deductible plan, if you're 9 times out of 10, you're a pre-65 retiree. If that's you, then our high deductible health plan is changing pharmacy managers. We're going from Express Scripts to CVS Caremark or RX Benefits. It basically means you're going to get a new card and you're going to have to give your pharmacy the new information, but it doesn't mean that you necessarily have to use CVS. It's accepted at over 65,000 pharmacies nationwide. It's just notifying you to make sure that if that's you, like me, I'm under the high plan that's going to affect me as an active member. This is affecting both active members and retirees. So I'm just trying to remind everybody of that. And then my last and final info is, this is just a friendly reminder. And at the budget board meeting on May 8th, the board did approve and make a mandate that anybody after May 8th had to go and obtain their Medicare Part A and B. A, you would have earned from your work history. B is your election that Ms. Vicky spoke of. That's the one you have to pay $174.70 for right now. But you got to have it in order to continue your district insurance. So keep in mind, because I have a feeling this is my next question. Hey, Trish, I'm 67. I never got my Medicare A and B. Okay? That doesn't require that you have to go get it. This is if you are turning age 65 after May 8th per the budget board direction. Okay? But as a member who has A and B currently, you still have to maintain it in order to be eligible for district insurance. So if I see a couple puzzled looks, so I'm going to try and give a couple examples. Maybe I have A and I never got my B. Or maybe I have B and I don't have A. This is not a requirement that you have to go and get it, okay? This is for new members coming on board. Maybe I'm 64, okay, and I'm coming on the cusp of age 65, which is my Medicare eligibility, and I am retired from the district. That means I need to make my way to the Social Security office and apply for my Part B, get my A. A is automatic. It should be automatic based on either your work history or your spouse's. And then 2, I have to enroll in Medicare Part B like boy. And then I have to let the district know. You got to connect with us. That way we can have you sign off on those changes. We can get a copy of your card. And we can update your premium information for you too. Does that help? Questions? Y'all have asked a lot of good questions along the way. Yes, ma'am. No. Her question was, what is the drug or the pharmacy benefit manager for the Humana group? It's WellCare, if I'm saying that correct. My suggestion would be this. Any Medicare-approved prescription will be on that list, but I would, again, call the customer service, get all your pharmacy information together, make sure that the drugs that you're currently taking are covered should you want to change to the LPSS Humana plan. I'm going to call it vetting. Make sure you connect with customer service to vet. I'll put that huge disclaimer. We do it now for our current members. We don't let anybody transfer from Blue Cross to the Humana plan unless they've had a conversation with Humana. I wouldn't want to put you in a precarious situation that's going to be detrimental to you or your health, okay? So it may work for some members and it may not work for everybody, but that's what I want you to do a double check on to make sure that it does work for you, okay? Because then we're in that circumstance where you'll be under that plan until the next open enrollment. I see your hand. Not to my knowledge. I'll repeat his question. Okay. Correct me if I'm wrong with your question, sir. He was asking whether our LPSS plan is being utilized in other districts. Other districts could have something similar to our plan. Okay. The Humana plan. Other districts could have something that's similar, but it's specific to our LPSS retirees, and it's specific to you. I'll give you an example. I think Rue Iberville has the Blue Cross Med Advantage plan. There's other districts that have chosen something else. St. Tammany Parish has a Humana plan. Am I correct in that? It's based on direction from their board is the best way I can describe it, which is your board approved on October 9th. You okay, ma'am? I hear you. We got some water out there for you. Okay. 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 How long has the plan, the LPSS Humana plan, been in existence? 2008, if I'm saying that correct. It's been a program for LPSS for quite some time, and it's changed throughout the years. I'll give you an example. A member who may have been on it in 2015 and gotten off of it for whatever the reason, it's not the same Humana plan currently, is how I would describe it. Just like your Blue Cross is not the same that it was 2 years ago, 3 years ago. Deductibles have changed, co-insurances. Well, not co-insurances, but other things have changed within your Blue Cross plan too. I'll just use that as an example. We have about 430 members currently on it. Every single member that I have had an opportunity to speak to, they rave about it. They love it. They wish they would have made the change a long time ago, and it works for them. I'll tell you the same thing I tell active members. What may work for you may not work for the person sitting next to you, which is why I overemphasize, please, 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 connect with customer service and ask your individual questions, because you may very well find out that the 6 drugs that you're taking, 2 of them are only eligible under that plan. And I wouldn't want you to need that prescription and to make that change and then you be in dire straits. So definitely assess. There's a lot of information, but there's a lot of information for a reason. I want you to make the best decision. You've got a little bit of homework is what you've got. I would take a look at what works for you. If you're perfectly okay with that premium increase, then it doesn't look like you need to look any further. If that premium increase is perhaps too much for you, I would first start with our LPSS plan, the Humana one, the option available to you that allows you to go from one back to the other. And in all costs, if that plan doesn't work for you, then there are options, which Ms. Vicki also noted. She did note that there are resources with the state that can help point you in the right direction too. My only caution is if you do go outside of our plan, you just can't come back. Did that help? I appreciate y'all's attention today. I really do. Just know that you can connect with staff. You can ask those individual questions. You can email us or call us, leave us some detailed messages. And I will be around should you have some questions for me if you've got some additional questions. And I'm going to ask staff to come down in case there's several of you that got questions. Anything else? Yeah. Awesome. Thank you so much for your time. I appreciate y'all coming today.